Hello and welcome to Paint the Edges with your hosts James, Mac, and James Thayer. And we are, apologies, we're back to the original on the road equipment. So I'm traveling, as we were traveling on top of the travel that I was doing previously. So that was kind of cool, I guess, at the end of the day, or is kind of cool at the end of the day. So I'm currently in Utah, Salt Lake City, Utah, or Kamas, whatever, something along those lines. And I travel with a backpack and a duffel. So unfortunately, I had to be very selective with what I could bring or could not bring. And the whole headset set, to give you an idea, within my duffel bag, there are 4 vests, 1 t-shirt, 1 pair of shorts, 7 pairs of underwear, 10 pairs of socks, my toiletry bag. That's it. That's pretty much it. That's it. And then I had a pair of long pants and like a flannel fucking thing that I was wearing on it. That's it. That's all I have. And then my laptop and all my laptop accessories, which is then including the microphone and this. That's my life. That's how I travel. That's the extent of my functioning. So I was not carrying anything else. I did not have room for anything else. And that's pretty much where we're at. So we're back to original kind of travel set gear, and the quality is good. I just think the sound, I think my beard occasionally touches the fucking microphone. I actually think that's what happens, which gives it a little bit of a ruffle. But yeah, we're doing the things. Now, today's episode, I think, look, I've got do I have any stupid stories? No. I just, once again, what confirms to me is that humanity and society in general is just completely screwed, is when you travel. Dude, when you travel, you realize that I'm not just realizing this now. Oh, look at me being able to do the function. This is not my bad hip. This is my good hip. But can you see how I laterally have to lean over? Dude, when you travel, you realize very quickly how stupid society is in so many ways.
Often seeing society at its worst.
Yeah, at its worst. Just from people not having any form of concept of where they are in space, no ability to just delineate. There was one lady, and I was walking towards the what are the flat escalators, but they're not an escalator. In the airports that make you walk faster. You know what I'm talking about?
Just the walking track. I don't know what it's
the walking track. I don't know what it's called. Whatever. The conveyor belt for humans. The conveyor belt. And then I was literally walking towards that, and there was a lady ahead of me, and she stopped at the entrance of it. She was on the phone. Just stopped. Not on it. Not even there. Just stopped at the entrance, and just I just looked at her. And she was so busy on the phone, and then she turns and she looks at me, and she's like, "Can I help you?" And I literally looked at her, and I was like, "You're in the way." And then she looked down, and she's like, "Oh," and just carried on standing there. And I was like, "Oh, okay, cool. Fuck me then."
Yeah. I don't need to be anywhere.
I'm clearly the problem here. So, dude, I had to walk around this chick just to get on this conveyor. But it just proves to me once again that just there is no concept of where people are in space. People lose their minds. You go through TSA, you go through any of these things. Same thing happened to me when I was going through the security fucking turntile thing to test it, see if you've got the X-ray machine. Dude cuts in front of me, not realizing that he cuts in front of me. So I just look at him, and then he turns around and he's like, "Oh, sorry, you can go." I was like, "No, bud, just go." So he goes. Yeah, you're already here. I'm already irritated. Goes and he walks in, and they're like, "Have you removed everything?" "Yep." "Have you removed your belt?" "Yep." Walks in, puts his hands up. The thing beeps off. He's like, "Oh, I've got my belt on." I was like, yo, dude, it's not hard to. Anyways, fuck it. Travel just brings out the worst in humanity, in my opinion. So Yes.
The traffic flow is always the funny one to me because like there's few more condensed spaces of just heavy flow traffic, people trying to get to a place in a small allotted amount of time that they have, and you'll have huge packs going in a direction and somebody just stop. Like they get distracted by a store, they're looking for something, but like it's never strategic and like, oh, let me veer to the outside. Yeah, it's just I'm gonna stop and just hope traffic now deviates around.
Yeah. It's everyone else's responsibility to work around them. Yeah, dude, that's, I don't know, whatever. Societies, I just want to be unalived for like a few days. I feel like that would just make everything feel better. Just like 3 days. Give me 3 days. Completely unalive me. Let my body recover. Let things heal. Let my brain not be frustrated. And then
Just
come
a
back.
good restart. The old have you tried turning it off and turning it back on solution.
Yeah, of my own human body. Like that would be great. Anyways, today's podcast. Look, we're well aware that maybe over the last, I don't know, dude, 12 episodes? The last like at least a month. And it's not 12 episodes, but over the last month, maybe the education side hasn't been so educational. Maybe it's been more life experiency than educational.
There's been a lot
which
of
is
life
fine.
going on, to be fair.
Yeah, there's been a lot of life. So we really kind of want to like double down or push into the education side today, and hope over the next few days. Again, off the back end of that, if you have extra topics that you really kind of want us to dive into and discuss at much greater lengths, like leave a comment, subscribe, do the thing. Leave a comment on YouTube if you're listening to this on Spotify or Apple Podcasts, whichever one it is. I don't know, shoot us a message, something along those lines. We do appreciate you giving us a direction. If you're taking the precious time in your life to listen to myself and Thayer, more so me, talk absolute fucking shit, let me at least try and do something positive for you. So, shoot us a message. But I think every now and then we have to come back to basics. Every now and then we need to hit the reset button on life, but in this case, the upper body mechanics, because it's still the thing I see butchered the most. And I hate to do what we kind of came to a conclusion with last year, where the basics work the most, and most people are still messing up the basics, and we don't really want to go down that path again. But there is a time and a place for us to come back to it. But having a keen conceptual understanding of what is going on at the upper body mechanics and reinstalling, maybe we need an update on our software here, but reinstalling or updating our software of the base foundation mechanics of the upper body is a good place for us to start. So we're going to dive into upper body mechanics today, specifically that of like in my opinion, the base foundational principle that flows into anything upper body specific, right? So in PSR1, we go through shoulder, hips, and spine, and specifically when we look at the shoulder, we look at the shoulder from a assessment standpoint without what I would refer to as true or direct assessments. Okay, and what I mean by that is we moved much further away from like a direct shoulder assessment versus the lower body. We can look for direct internal external rotation in terms of assessment base. We can put someone in a 90-90, or we can even looking at someone in maybe some form of lunge, but that's not necessarily direct. But looking at someone in terms of a 90-90, we can get a true indication of what is going on in terms of internal, external rotation at the lower body. When it comes to the upper body, I'm still of the very strong opinion that your exercises that you do on the general basis, something from moving your arms from your side in an abducted position and going up overhead, so from 0 to 120 / maybe 180. Let's kind of take into this 180 position, as 180 as we can when we get up overhead. That is going to give you your truest indication of what is actually going on at the shoulder, right? Because if you can understand that, and if you can understand what to look for in a movement or an exercise that takes your arm from at your side to up overhead, and you can go through that continuum, go through that arc, and either experience discomfort or pain or watch the mechanics of it, that is your shoulder assessment. That gives you everything you need to know in terms of what to work on. Now, the only way that those shoulder assessments become effective is if we have the overarching principle, or overarching kind of theme of what I would deem kind of that the upper body mechanic of putting someone in Scaption. I still think that Scaption as a global upper body principle is the only thing that matters. And when I say only thing that matters, is the only thing that matters in giving you a true understanding and true assessment of what is going on. We see time and time again of practitioners or clinicians assessing internal, external rotation at the shoulder from a 90-degree plane. And I always push back against that, because we're not moving at 90. We're not performing our exercises at 90, or we should not be performing our exercises at 90 degrees. We shouldn't have our arm literally at this 90 when we're pressing. Okay, we're not in a safe, maybe say safe. We're not in a safe position to press from here. We're not in a safe position to express force from here. You can't assess someone in this 90 degree and then tell them to move into Scaption to do their lateral raises or their pressing. To me, the two, they have to match. You can't use that assessment and say you have shit external rotation when that's not the position you're going to be required to get external rotation from. All right, so I think Scaption as a whole, and the understanding of the position of Scaption and how it integrates into not just a shoulder exercise, because I think that's the missing link, is we started learning that Scaption is about, and directly reference to that of a lateral raise, and then some people manage to extrapolate that out into some form of pressing overhead. We gained some understanding, but we still forget every now and then that Scaption as the base principle, aka the position that we put the scapula into its neutral position to move congruently around the rib cage. So Scaption moving away from just being a shoulder overhead principle to a full upper body principle is kind of the lens that I want to inject into the world. Thoughts?
Yeah,
so that was long-winded.
No, but I think that gives a great overview of what we're looking at discussing today, and giving a starting point for it is, one, at the base, understanding what Scaption is, of it being that scapula in a neutral position to allow it to move more fluidly around the rib cage. So that is a starting point. Understanding that in itself, we're trying to find a anatomically advantaged position to start the movement. That why this is such a reoccurring topic in a position that we hold, because at the base of where the scapula is, are we at the starting point? Are we behind it? Are we ahead of it? Because it's going to impact how the movement proceeds. Our barbell course does a great job of talking about setting up before unracking, because we aren't going to be able to get that position back once we now load it. Similar to, if we're not able to find a neutral starting position, it's going to create some disadvantage of how now we initiate and move through that spectrum of the movement, not having that awareness, not having that position. And we'll talk about different exercise, how that can impact it. But then also the contribution of the scapular humeral rhythm, and how that experience, or how that interchange is going to happen with the 1/3 of it coming from the scapula, 2/3 coming from the humerus in movement, in going overhead and going through extension. Now, the thing is, we discussed quite a bit in PSL1 that it's not a 1-to-1 ratio. And that's sometimes where it gets lost, is it's only around that 90 degrees where the scap really starts to contribute to that upward rotation, allowing the humerus to go into flexion. If we're already moving or in a position where we're disadvantaging that rhythmic nature of the scapula and the humerus being able to work together fluidly, it's going to have ramifications in position, and execution of technique. So as a starting point, it's that understanding of why scaption is important, because it's the starting point. If we're not on the starting line, it's going to impact how we're able to proceed forward, and going to have influence of what positions that we can find, what positions that we can create, if we never start in them or we never lose them. And to that, the assessment piece not needing to happen in isolation, but it's going to be of a greater benefit to see it through the fluidity of the motion, to see where these compensations happen, where these limitations, because to the point that you were displaying, and wonderful, we're on YouTube, so there is the video component of it. If we start at that 90 degrees for the typical like external rotation, it's very, very rare that we're asking, or should even ask, of needing to be out here to press. So really it's looking, can we express force? Can we create stability in positions that we're actually going to train and we're going to operate in, getting that direct, kind of the direct exposure to it, to be able to assess, be able to train with it. Because a lot of these, assessments that we might see online, or that we might even find in courses, it's kind of operating to the extreme, and doesn't take in, again, account where we're actually trying to express in. It's more so that extreme, or the end of the spectrum. For example, the internal, or sorry, external, if you're listening to the display, I have my arm at 90 degrees rotating out an external rotation. If your scapula isn't stabilized in that, because it's jammed against your rib cage, because we put it at its end point that it can try to position and move. So there's huge issues if it has an inability to stabilize in that, because we're not giving it a choice. We're utilizing the structural position to just jam it on the rib cage, in that that's not actually where we want to be. That's not what we want to fight against. The point you're going to get to is that position and how it operates. But to allude to that, to start to proceed in it, think about an individual, that is bench pressing. And again, those of you on YouTube, if we're at this 90 degree, we're going wide here, we can't do much with our shoulders are there. This is what we have. So now this is where we're putting a lot more load on that interior delt, hoping that it holds up, and that our, rotator cuff is just willing to hang on from this, grander, or this extended position of a wide grip bench press going through. And we've all seen individuals do this, whether it's a push up, whether it's a bench press, but it's basically just asking a lot more of our shoulder than is necessary, whenever we can utilize a better starting position and the fluidity that is offered through that scaption position, to now incorporate the scapula and that glenohumeral rhythm into the equation, than just stapling down our rib cage, or our scapula against our rib cage, and saying, hey, I hope my arms can move through this pattern and everything works out.
Yeah, the big thing with this is, once again, it's the understanding that the principle governs absolutely everything. Like and this is, and I'm sorry if it sounds like I'm repeating myself, but I do want this to be very much understood. That scaption as a principle is not just a principle that should be applied when we talk about delt-focused exercises, right? And I think that is, and I don't know if this has been relayed or interpreted ever before. And I hate that we have to, in a way, because again, it's the critical thinking standpoint, but maybe it needs to be kind of explained and it needs to be verbalized. Is Scaption is the neutral scapular plane, the position in which the scapula can move in its ridge and in its line congruently against the rib cage. Now, that is not just in delt specific exercises. That is in any position that we move our arm away from our body, whether that's an abducted position, whether that's a flexed position, whether that's an extended position, so bringing our arm back behind us. So when you think about that, to take it one level more regressed, that is any form of pressing movement. That is a chest focus press, a shoulder press, incline press, whatever fucking press you can think of. Any way in which we move the arm, whether it's horizontal, whether it's slightly into flexion, whatever you want to define it. Any form of chest exercise, Scaption is a principle that needs to be thought about. Any form of pulling-based exercise, so any back exercise, whether it's horizontal, whether it's from a vertical pull, whatever it is, Scaption needs to be thought about. Any form of abducted position, Scaption needs to be thought about. Like any form of arm exercise, biceps, triceps, all of that. And it's again, I don't know why. I know why the critical thinking element comes in, but the labeling it as it is a base foundational principle and it should be there or at least thought about in the position you set yourself up as you said, if you're already putting yourself in the end range position, you can't do anything off the back end of that. If I'm setting up for a tricep extension, like an overhead tricep extension, and I'm in a position that is just loading joint or forcing joints to have to stabilize, it's like, well, the secondary and tertiary benefits of that exercise are now gone. Thinking about what the long head of tricep does or where it attaches through to the scapula. It's like, use that concept of like, well, if it's going to be calling upon or it has some form of origin insertion or it's going to be utilizing the scapula in some shape or form, and it does because my arm is up overhead, right? Well, then we need to take it into account when we put ourselves in the correct position that we are setting ourselves up for that exercise. So, in my head, when I start extrapolating this out, is it's the first point of call that we should be looking at in any form of execution, right? So, I played around with this idea or this concept, and I'll try and visualize it for those on YouTube watching. Great. But the idea behind it is like we know Scaption's going to be at this 30-ish degrees ahead of us, roughly 30-ish degrees, depending on the size of the ribcage, fine. Now, depending on the height in which the arms are at, if you're at, kind of just outside, call it 80 degrees, if your arms are straight out and locked, as you would for like a lateral raise, all you do, think about this, is just bend your elbows and bring your arms slightly ahead of you. What position? That's your bench press. There's your press position. And that all came from the understanding of where Scaption is. So all I did there is like, well, now I can congruently get shoulder extension and even shoulder hyperextension. And I can get protraction that comes through at the very end range if I extend my arms out. It's like, so there's the principle applied in real time in both a press and then like, let's take it into a pull. I'm on a T-bar row. I'm on a chest supported row. I'm on something in a horizontal row. It's like, well, neutral, pronated, whatever you want. It's like straight arm, bend, pull. Same concept, same thing applies. It's like, okay, yeah. Like there's your real world application in the most simplest performed way that I can think about. So it's like, well, just add that into the mix. Add that into your setup, your execution, your thought process. So when you're looking at a client or you're looking at yourself in performing this exercise, just look for where that arm position is. You mentioned, and like we said, if you're at this 90 degrees, all that's going to happen is the scap's going to dump, We're going to internally rotate. We're just going to try and find the ability to get our arm behind us, and it's not going to happen. Right? It's not going to happen by using muscles. It's going to happen by using joint structure. And that's the problem. But it's an easy fix. It is a very, very easy fix if you can understand this concept of scaption and how it applies across the board.
At the beginning of this, we talked about the kind of the assessment component out and how we are assessing more through the dynamic of the movement and how the individual or client's ability to hold or maintain the position through that fluidity of the movement, not necessarily isolating. But to the demonstration that you just gave of having scaption and that being a pressing, that being a pulling position, this is an effective way for you to assess on machines, am I in the correct setup? If you're trying to figure out what the height seat needs to be, where the starting pin or pressing position, this is the assessment. Set in the chair and see where that is in position. Is it too high? Is it too low? Is it putting my shoulder at more of this 80-degree position that I'm trying to press from? That's the tool in the way in how you can implement it in having a visual aid, having an assessment of am I in the correct position, and how that's going to carry over to pressing, pulling, bench press, machine chest press. Like all of these should have a similar signature in the look and the aesthetic to them, because we're operating in that position, which is going to allow us the greatest ability to utilize that scapulohumeral rhythm to be able to execute.
Yeah, and I think, a quick side tangent on that, but a very important thing you mentioned, obviously, like glenohumeral rhythm. So as a concept, or as like, I don't know, as an industry described principle, it is for every 2 degrees that the arm moves, the scapula should move 1 degree. However, so that's the industry's definition. Us as Prescript and individuals who have kind of thought about this, I think you actually apply and actually train people. I think important concept, have kind of adjusted that ever so slightly, that only comes into effect when that arm reaches 80 to 90 degrees of flexion. Like Thayer mentioned this before, but I think just quickly touching on it and highlighting it is important, because if you're at home right now, and please, if you're driving a vehicle, don't do this. But if you're at home right now and you're listening to this, put your arms at your side and move your arms out 15, 20 degrees. Tell me how much your scaps just moved. Because in theory, according to the principle of the industry standard, or the definition of the industry standard, if you just moved your arm out 20 degrees at a 2-to-1 ratio, your scapula should have moved about 10 degrees. Now, I can quite confidently guarantee that your scapula did sweet fuck all and didn't move anywhere, right? So it's us being able to take this principle and actually apply it in the real world setting. Of like, it's a bookend principle. It's someone who's obviously written it from a biomechanical standpoint, and biomechanical in the element of like a 2D model, without the concept of applying the human, the space, the time in front of us. Right. So, as they mentioned, their glenohumeral rhythm becoming effective from, I'd say, the 80-ish degrees, 80 to 90 degrees of when it actually starts to move. Right. So it facilitates the acetabulum, facilitates the ability for the humerus to move within the glenohumeral joint and actually get into the overhead positions. All right. Now, when you look at that principle, you can then take it out in terms of the whole, like, do your scaps move in a bench press? Do they, like, there's a whole other, the argument that comes into play in this. But, it's something to take note when we are doing any form of push or pull. Thayer mentioned now that utilizing a horizontal pressing or pulling, and then finding that arm position and finding the ability on a machine to then put them in the right position to do that. That's your assessment tool. You almost don't have to worry about glenohumeral rhythm right now, in that. You don't need to watch for the scapula to move. It shouldn't be moving in an upwardly rotating position. It shouldn't be going through that simultaneous axis of movement at this time. And it kind of controls variables, is kind of how I look at this. Now, when you put someone into that position on like a chest press machine, think about it. Let's think about like a flat chest press machine here. My arms are going to be in this 80 degree. Now, as I start pressing, the only thing that I really want to focus on in terms of my scaps here is, can I find protraction? Can I initiate and can I move the scapula around that rib cage effectively in this horizontal press? Does it move slightly? Do we get protraction? Does it come back in retraction? Right? It segments out issues that could possibly be at play when we are assessing someone. Are they able to retract and depress? Two different things, but very important for the overall stability concept of that shoulder girdle. Right? So by putting someone in this position, finding 80% or 80%, any degrees of flexion, assessing where they are at in terms of that, we can now really look at like, well, do I need to double down on like serratus work? Are they finding protraction here? Are they able to actually move that scapula around? No. Okay, cool. Well, now I'm going to do serratus things to help facilitate that. Right? Here's my assessment tool. Here's my intervention. Immediately in terms of that, and take it back, full circle it to a certain degree. This all comes down from understand scaption, put them in the right position to express scaption correctly, aka your assessment. Find your intervention for your assessment off the back end of what doesn't work. Way more effective than like arm at 90, external rotation fucking bullshit. There it is. It's utilized in its actual practice.
And as we extrapolate that out, looking for that key component, it should help develop that coach's eye to start expanding, start see more of a global process. Because an important thing that you've brought up in this explanation is the scapula moving around the rib cage. So if we understand the scap should move around the rib cage should not be moving. So if we're evaluating our pressing and pulling and we're seeing a lot of sternum down, sternum up, we're not having the scapula work into that protraction, retraction, but we're trying to create an artificial position through the change of our rib cage. So now, again, by understanding that simple principle, we can start expanding out to see what's happening, what's going on, to then evaluate more globally. And that's one of the components that we'll see is we can't have both pieces moving. It doesn't curate the environment of a stabilized position to allow for that scapula to mobilize around the rib. So if we have both pieces moving, it eliminates what we're trying to achieve, and it should send up some red flags of like, hey, we need to address this, or this isn't being performed correctly. Another place where my mind goes is, you've referenced it before, but apologies. Sorry for listeners. But we've referenced it before that the scaption isn't just isolated to delt work, but there is influence in that position to be able to utilize the delts and how we train it. And this is something where I know you've had long discussions before about the difference between a lateral raise and a side raise, that they're not the same. And scaption becomes a crucial factor in trying to define that difference. But again, understanding these principles of where the position is as our starting point, what that is allowing us to be able to technically execute in exercise, and really where the demand, where the need is coming from. So whether it is that that connection of the scapula and the rib cage moving, that we need to create some disconnect between those to allow one to stabilize and one to move around, whether it's just the positioning of a lateral raise and a side raise, that they're not the same, but also in delt work specifically. I think understanding this principle of scaption helps better understand the continuum of the movement. A lot of people in training the delt specifically that we'll see is there's this huge arch that they're kind of going through, or arc that they're going through, to try to create these delt raised positions, not understanding, to your point, that the scap isn't becoming a factor until that 80-90 degree position. And so the 15-20 degrees initiating abduction being the supraspinatus, that we're now loading a position that is not directly correlating to the work that we're trying to put tension across. So it's less effective, and if anything, it's surpassing the position of value that we're trying to create. Because if we're going through these arches or different arcs, that now the scap is or where it's going to be most effective to be able to utilize that position. And if we're trying to, or if we're taking that scapular humeral rhythm outside of a position where it can maintain effective tension on the muscle that we're trying to train, that we're trying to develop, ultimately it's wasting time, wasting energy. And in again, how understanding this principle of scaption that we're discussing, how it expands out to so many different iterations of exercise is important, that we can start applying that critical thought through one question or observation of position, but extrapolate it out to the upper body movements, to the positions, and using that as an assessment tool and check-in to determine, are we in an effective position or not?
The scaption becomes what I would refer to as like the nucleus in this entire thing, because it's our reference point, right? Because without having a controlled reference point, everything else that we either adapt or change, we don't know what is actually making an effect, right? So, and I take this concept where I'm applying the similar thought process of, if I'm making decisions on clients' nutrition, clients, any form of intervention, it says if I change too many variables at once, or I don't have a consistent variable at play and then change something else, I don't know if what I've changed is the thing that's making the result. At the end of the day, the adaptation that comes off the back end of that, if I've changed more than one variable, I don't know what's actually working. Right? So when you have Scaption as your reference point or your foundation, when you change any form of these other interventions, whether it's arm position in relevance to that of where Scaption is, if we then change grip, if we change even like sternum angle, if we change position on the bench, if we change height in which the arm goes to, like all of the variables that then change, you don't know if it works or not. You don't know if your intervention at play is the thing that's actually creating the result, whether it's positive or negative. So when you have a stable base, it makes your life 10 times easier in terms of your next decision makings. Right? You can then go to more advanced decisions or less. And every single time you go through this, you actually are going to be able to, you can test your hypothesis. Hypothesis is, I made X intervention, or I've increased training, or I've exposed someone to more rear delt work, right? To give me more access to external rotation. Did this help with the bench press or not? Yes. Cool. I kept everything else the same. So it's improved the ability. That was the thing. That was the problem. Now I've worked out what it is. I've brought my intervention in, and we carry on. Right? I think there's a big positive to understanding your reference point and having a solid reference point to then keep everything else moving off from there.
Yeah, having the base is essential to know where you're starting and where you're going. We've all been but all been in the place where it's like you're here and here's the map of it, and how fucked you are whenever they don't have the star starting points. Like, where the hell am I in the park?
Am I? Correct. Yeah. Yes. There's the sticker of the "you are here." It's like, well, I don't know where I am, so this map doesn't help me. It literally is just a map. It's not a map in relative or reference to where I currently am. Now, you you spoke about, I think, and it's something to touch on again, and it's whatever. It's more education off the back end. This, I think, the understanding of muscles that pull on, or understanding the difference between, and I'm going to really dumb this down, but muscles that move arm to scapular bones and muscles that move scapula to rib cage is going to be a very effective index of exercises, is going to give you a very effective index of exercises to make interventions in the long run once you've got this foundational play down, right? So we spoke about exercises being this assessment. If I take someone through a lateral raise, or even, the discussion is I put them in the right position, their arms are in the right position, we start pressing, and this literally could be, I take someone into an overhead press, not completely overhead, maybe a 45-degree incline press. We 45-degree incline press. They're perfectly fine at the bottom, and as we start pressing in this 45, they get shoulder pain, or they get discomfort that comes forward. Now, because we have controlled our variables, our foundation is at play. We know, or we can ask ourselves the question of, where is the issue being present, or where's the issue that is presented to us here? Is this a arm bone to scapula issue, or is this a scapula to rib cage issue? By knowing where our arm is in relevant or in relation to scaption and glenohumeral rhythm is going to give us the answer. If someone experiences pain from 80, 90 degrees and above, we know that that is a scapular issue, because the scapula would have to move to facilitate that joint or facilitate that space for the glenohumeral rhythm to get into the position it needs to. If the pain or discomfort occurs from 0 to 80 to 90, we know that that is a arm glenohumeral to scapula, because those are the muscles at play that is moving that joint. Right? Whether it's delts, whether it's rotator cuff group, infraspin, supraspinatus, any form of teres major, teres minor, slightly dependent in terms of those, but like anything that's kind of coming in that, like there's your furthering of your assessment tool. Because you had your foundation at play and set in stone, you can now fix the problem that much faster. So if someone experiences shoulder pain or discomfort overhead, we go scap to rib cage. We look at the muscles that go scap to rib cage: lower trap, mid trap, upper trap, serratus anterior, rhomboids. Cool. Do interventions or exercises that reinforce those doing their function, and you'll likely improve and or get rid of that pain and allow everyone to progress straight off the bat. Like, it's as simple as that. Like, it isn't more complex than that, but it's not more complex than that because your initial foundational work is solid. Once you have that solidified, everything else becomes easier.
It allows you to stop chasing your tail, to stop going and trying to take shotgun approaches, to seeing everything on the internet of, here's the 20 different things to fix my shoulder and I'm just going to try them all. It differentiates where the focus really needs to be, and it expedites the process to find that solution, to get back to the important thing of training, being able to load it, being able to drive intensity, and doing the thing. If you're listening to this podcast, I expect that you love or mildly enjoy at the least bit, or see value in. But it's really about that, is like cutting through the bullshit, being able to be more definitive in our approach and the focus, to stop spinning our wheels and just get direct to the answer by, again, resorting back to the principles, to the basics, because the solution is there. It's in that, and that's quickly how we can extrapolate that out to get back to improved training.
Yeah. I you know, it's complex, and it's supposed to be complex, but you can you can shift through and wade through the noise and the bullshit to be very precise at fixing the complex problem that much faster if you have the base foundation down. If you don't have a starting point, you don't have a reference point, and you hit the nail on the head, you're just chasing your tail. You're just running around in circles. You've got no direction. You are here on the map, and you can't make any decisions, whether that's the right or wrong decision. You can't even start making a decision because you've got no idea where you currently are. Paint the edges. That's it. Look, education. Look, we got an education episode up, guys. As I said, kind of, at the very beginning, if there are any other concepts or things that you want us to dive further into, shoot us a comment, shoot us some topics. But as always, we always appreciate any form of comments that are not just nice. When we got the comment on YouTube, it was nice. But anyways, guys, appreciate you all, and tune in next week, and we'll continue. Hopefully, we'll do an education series for the next, 4 or 6 weeks, depending on what comes in. But until then, we'll chat you later.